friends, welcome to my YouTube channel AriYa. Today is our topic blood pressure. Then starts. First, definition of a blood pressure. Blood pressure क्या है? It is the pressure circulating against the wall of blood vessel. Then blood pressure reading is taken in two numbers. First systolic and second diastolic. First discuss systolic. It is the pressure of the blood in the arteries when the heart pumps, and it is top number of blood pressure. If the blood pressure is 120 by 80 mmHg, mmHg means millimeter of mercury, then 120 is the systolic pressure. Then discuss diastolic. It is the pressure of the blood in the arteries when the heart is filling, and it is bottom number of blood pressure. If the blood pressure is 120 by 80 mmHg, then 80 is diastolic pressure. Then discuss difference between systolic and diastolic blood pressure is known as pulse pressure. Then discuss blood pressure ranges. First, blood pressure 120 by 80 is considered normal. Then 120 by 80 to 139 by 80 is considered pre-hypertension. Then above 150 by 90 is considered hypertension, means high blood pressure. Then below 90 by 60 is considered hypotension, means low blood pressure. Then the systolic or diastolic pressure is certain drop 20 mmHg is considered orthostatic hypotension. Then discuss factor determining blood pressure. First, hypotension means high BP, age, obesity, exercise, headache, heart and kidney disease, and medication. Medication, corticosteroid. Lot of use corticosteroid. Corticosteroid example, basically prednisolone medication. Then discuss hypotension means low BP, bleeding, burns, vomiting, diarrhea, medication. Basically beta blocker medication. Example, atenolol, metoprolol, propanol. Then discuss blood pressure measurement technique. It's basically measurement 5R. First R means rest for patient 5 minutes before blood pressure reading. Then second R means refrain or avoid talking while resting and during blood pressure reading. Then third R means remove upper arm clothing. Then fourth R means rest arm on the supported surface with cuff at heart level. Then fifth R means rest feet flat on floor in seated position. Then discuss method of measuring blood pressure. These are two types. First, direct method, and second, indirect method. First discuss direct method. The technique involves direct measurement of arterial pressure by placing a cannula needle in an artery, usually radial, femoral or brachial. Then second, indirect method. Following types of measuring device is available. First, mercury manometer, second, Android manometer, and third, electronic BP device. But taking is using Sphygmomanometer. Then BP check without stethoscope is known as palpatory or auscultatory method. Then blood pressure recording article. Then showing image. First, automatic BP monitor or dynamic vital sign monitor. Then second, mercury sphygmomanometer. Then third, Android manometer. Then fourth, electronic manometer, and it's also known as digital sphygmomanometer. And last, stethoscope. Then discuss steps for measuring blood pressure. First step, patient seated for 5 minutes. then provide proper position, then expose upper arm, then center of upper arm at heart level, then cuff applied 1 inch above crease at elbow, then locate brachial artery, then palpate radial pulse, then implant cuff until pulse disappears, then let air out, then place stethoscope on brachial artery, then pump up cuff to 20 to 30 above point of obliteration, then last let air out at 2 mm Hg per second. Then discuss do not take blood pressure reading on a client's arm. First, if the patient's arm has an intravenous infusion, then do not check blood pressure. Then if the arm is injured or diseased, then do not check blood pressure. Then if the arm has a shunt or fistula for the renal dialysis, then do not check blood pressure. Then if the BP apparatus is defect, then do not check blood pressure. Thank you.